Hi, everybody. This is Tim Johnson. I am in the neighborhood. Love those soft starts. We're here with Daryl Carlson today. Welcome, Daryl.
Thank you.
And you're with the Alzheimer's Association.
Not old timers?
Not old timers.
No, not old timers, not Alzheimer. It's Alzheimer. It's German scientists that discovered it.
Alzheimer.
Is it?
Yeah.
Hence the spelling, which isn't easy either.
No.
And yeah, Stacy, welcome. Sorry, didn't introduce you, but Stacy Borho here. We're talking generally about Alzheimer's and all
Alzheimer's
that.
disease. Yeah, really fun subject everyone loves to talk about. It's the sixth leading cause of death with no cure. Yeah, so it's a tough subject to talk about, but it's a very important one.
Most everybody's been touched by it some way with a relative. My grandmother had Alzheimer's, and I can remember the story of she had fell and slipped and broke her arm on the ice, and suddenly realized that that she had a broken arm, and she looked at her husband, who she's been married to a long time, and said, "You did this to me, didn't you?"
Yeah.
And got mad and started hitting him, and it's just one of those diseases that not only changes your memory, but it changes in personality too.
Yeah, changes in personality, changes in physical abilities to care for yourself, to keep yourself safe. It changes the way that people have to relate with the person with the disease, and that is probably makes it one of the hardest things for people to deal with. It's just this person is not the same person that I knew. It is, but it isn't, and it just makes it difficult. Yeah. So this is something I think everyone, sometimes it's easy, especially if you're younger, you go, oh, well, I don't have to worry about that. It's an old person disease, Some people can get it before the age of 65. The vast majority of people after the age of 65 develop a disease. But it is something that really affects everyone, at least in our society, because the projections are really frightening as far as where this disease is going. Right now, we have 5 million people in the United States with the disease. By the year 2050, if we don't do something to slow it down or stop it, we're looking at 15 million people. Medicare, Medicaid expenses that the society paid for last year to care for people with Alzheimer's disease, $236 billion. You're looking at $1.1 trillion every single year by the year 2050. Right now, globally, 47 million people have it. By 2050, we're projecting out to 132 million people. So this is something that will affect everyone, if it hasn't already. So it's an important thing for everyone to understand what it is. And we really strive to emphasize early detection. Know what to look for. Don't be afraid to talk about if you're seeing signs. And catch it early, because even though we don't have a cure yet, there's still a lot of things you can do if you do develop a disease. And a lot of times, because it looks like getting older, people can just assume it's the worst and do nothing about it, not realizing there are lots of different things that can bring on like a dementia diagnosis. And some of them are some of them are treatable, some of them are life-threatening, but we can do something about it. So it's really important for people to pay attention to that and know what to look for and be proactive. It's part of what I do with the association is help people do that.
So is there a test for Alzheimer's that they can take? Is it what kind of
yeah.
test is it?
So we would love to have a simple, quick little blood test, and now I know. A diagnosis takes a while, a couple years even, total start to finish. But there are signs that you can look for. And we have 10 of them that we lay out. And I wouldn't go through all 10, but if people want to know just the really good shorthand, it revolves around the first thing you look for, memory changes that disrupt your daily life. So we're talking significant memory changes. Now, like forgetting where your car keys are, as annoying as that is, that's not going to really negatively impact your life. Okay. But if you lose the car keys and you completely lose the ability to be able to retrace your steps in your mind and find them, that is a significant change. Okay. So the first sign is always a memory change that disrupts your daily life, and it really is a negative impact. That's the most significant one. Then there are several others of different kinds, different stripes. Increased small motor vehicle accidents can be a sign because one of the signs is visual changes in vision, not just needing glasses, but really, like if you're driving and you start to be confused by looking in the rearview mirror, the side view mirrors, and that's just like, your brain's like, oh, what do I do with that information? That's an indication. Losing the ability to retrace your steps is another one of those indications there's something else going on. Having really a hard time doing something that you had done all your life, like being at the grocery store that you've always gone to and you can't remember how to get home. That is significant because you've driven home forever, you know, or you have a game that you've played all your life and you love this game, and all of a sudden now maybe you're playing it off like, oh, I just don't feel like playing that game anymore. But inside you know, okay, wait, this is confusing. I don't remember the rules, and it's just, I can't keep up. It's too hard to think about this. Those kinds of things are indicators. So if people see that, talk to your doctor, talk to each other. And the hardest thing to do is to talk about it, because it's like, you know, it makes you feel, I feel stupid, I should remember this, what's going on with me? So it's really easy to hide it. It's very easy to feel like I'm going to embarrass the person if I notice like my mom is having some issues. How do I talk to mom about that?
Sure.
But it's just important just to have the conversation and talk about it. So.
Wow. So are all these 10 signs out on your guys' website?
Yep. So we have an award-winning website. The national organization does, alz.org. If you go /Illinois, that'll take you to our state chapter page. There's all the information about knowing the 10 signs is on there. We have a whole caregiver section. So a big part of what we do is helping people that are currently caring for someone who has dementia, because their job is a hard one. So we have a whole caregiver resource section of the website, which covers answers for every question you can possibly conceive of, resources to help them connect with community organizations that can help them. I do education in the community, both for the general public with raising awareness and understanding, but also for caregivers, helping them know, okay, how do I communicate with my loved one now that they have this disease? They're having these behaviors and I don't know what to do, and it's really, sometimes they can get violent, you know, start hitting. What do I do? And I'm so stressed out, how do I keep myself from having my health fail? So those are some of the things we cover. We have that information also online, recorded webinars. We have live webinars, live education by phone. So we have lots of different avenues that we really want to connect with people, let them know they're not alone and that there's resources there to help them.
Wow.
So what's the cause of Alzheimer's?
Yeah, I wish we knew that for sure. Because it's the brain, there's so much we don't know. You know, like I said, it's the 6th leading cause of death. It's the only top 10 killer we don't have a cure for, even a way to slow it down yet. We do know, in general, it's caused by excessive buildup of a kind of proteins in the brain fluid, okay? Beta amyloid and then also tau proteins, okay? So the beta amyloid protein excessive buildup sort of gets between the neurotransmitters. You know, basic science, you have neurotransmitters and they shoot signals and you got the fluid in between. If that fluid gets thick and gunked up, it starts to gum up the network, the factory. And if you have a factory assembly line and one piece starts to break down, you know, it can have a bad ripple effect fast. And that just starts to kill neurons, but then it just spreads and it grows. The other protein gets inside of the neuron and kills the neuron. So between those two, that's sort of how Alzheimer's disease starts. You can have that excessive buildup for decades before it actually starts to present symptoms, but we still don't even know yet how much is too much at what point, how much is normal. That's part of a big piece of what they're doing research-wise now, trying to figure that kind of thing out.
Different for everyone, because all of our bodies are completely different.
Yeah, exactly.
So it makes it hard. So what about preventative?
Yeah, oh, of course. What do I do to prevent this?
Yeah.
Really, it's really about general health ultimately, and then trying to do things cognitively. So in general, 4 categories that you can think about when it comes to brain health, and trying to decrease your risks. Prevention is a word that we don't want to use unless we have a lot of good research behind it to say, yes, we can, but we know that you can reduce risk. So 4 general areas, just health, body health, exercise, nutrition, what you're eating, keeping your brain stimulated cognitively, and then also social stimulation, keeping your interacting socially. So as you age, really watch those 4 areas and make sure that you keep learning, keep challenging your brain to learn something new, do something new. Exercise is so important. So a simple, one neurologist had explained a study that he had seen where 4 days a week, exercising cardiovascularly for 30 minutes a day, and getting your heart rate over 100 beats a minute. You do those things 4 days a week. After 6 months, everyone in the study, no matter what health level or what dementia level they had, they showed improvement in memory ability.
Wow.
And even the chemical in the brain that causes neurons to grow, there was an increased level found in that. And that's one study. With science, one study tells you something, but it doesn't always give you the full story. But we do know enough to know that exercise is really important. Social interaction is really important, and that causes a lot of different parts of the brain to work when you have to have a group of people and you're in a club and you negotiate or you do a project together. That's another thing. And then healthy fats for diet. Healthy fats, okay? Not saturated fats, not trans fats, not deep fried things, but nuts, good vegetable oils.
Avocados.
Yeah, and then, things like healthy oils found in like fish. We know that those are really good for the brain. So I have a joke I like to say, put down the deep fried Twinkie, pick up maybe a healthy trail mix instead, just make good choices.
That's funny. What about being hereditary?
Okay. Yeah.
I'm curious, but my grandfather he had severe Alzheimer's, and I'm assuming that he probably passed. He was in his 90s, but he had taken a severe decline, and it was heartbreaking. And he went through multiple homes too because of it.
Right.
And, it was really heartbreaking. And I know that my grandmother went through so much, and along with all my aunts and uncles, but. Is that hereditary?
That's another one of the big questions that we get.
Okay.
So, if your parents had it, you're looking at an increased risk.
Okay.
There is only one gene that we know that causes it definitively, but it is very rare. They nickname it the familial gene, and it always strikes very early, like 40s and 50s. So it's one of those things that if that was in your family history, you would look back and it would be blazingly obvious. One example, there's an HBO documentary about Alzheimer's and a gentleman, and it points to a picture he had of his mom's side of the family, and because this gentleman has this gene. And of like the 13 brothers and sisters and some of the aunts and uncles, only 3 did not die of Alzheimer's disease.
Wow.
So you look at that and go, okay, this gene is running in this family. For most people, that's not the case. Okay. There is a gene that will increase risk, and we know that. It's called the APOE4. It's the name of the gene. And you can have different combinations of it, so varying risk levels. But at worst, you're looking at a 50-50 chance. So when it comes to that, do I want to get a genetic test? We always encourage people, first talk to someone that's a genetic counselor that can help you walk through, do you want to take this test or not? I love this example. So Dr. America Morey, he runs the Center for Brain Health North Shore in Chicago, one of the leading researchers on brain health and prevention. He has a whole system set up to help people get tested and do what they can do to prevent. And he himself will not get tested, which is surprising. But he says it this way. He goes, okay, I know I have a family history. He says, I know everything I could possibly do to reduce my risk, and I'm doing it. But I want to find a cure. And I'm afraid that if I get this test and I find out that I have X amount of risk, that I'll be tempted to slack off a little bit and enjoy life, which is not a bad thing, but his passion is so big to find a cure. He's like, I'm not slowing down till I'm dead. So it's one of those examples of there's a lot of factors to weigh in if you're going to get genetically tested or not. But
plus, if you know or you don't know, obviously, like you said, your behaviors are... So you could also, if you think you're going to, maybe it was still 50-50 chance.
The worst case,
your mind just said, oh, I'm going to get it, so woe is me, and then it does come on because that negative mindset is surely...
Sure. If nothing else, you might be more tempted to take shortcuts and not take care of yourself as well as you should or do all these, But if you know the risk factors and you do what you can do to prevent, it's your best scenario.
Interesting.
We're here with Daryl Carlson. You're the manager, education and outreach for Alzheimer's Association here in Central Illinois. How far does that cover?
So we have offices that cover the entire state. Okay, so Alzheimer's Association now is a national organization. Out of the Peoria office, we cover the surrounding 12 counties. There's also an office in Bloomington and Rockford and Joliet and Chicago and Carbondale and Quincy and Springfield.
Wow.
So anywhere people are, there's a way to get help. And actually the best thing for people to do if they have any question is to call our hotline, 1-800-272-3900. That's a helpline, I'm sorry, I can't use the word hotline. Little different connotations there. But it's 24 hours a day, 7 days a week. I like to say if you have an issue, a question, a problem, at 3 o'clock in the morning on Christmas Day, call and some person will answer. We are there, we want to help people. There is no question that's too stupid, there's no situation that's too serious. And even if you're a caregiver, I even tell like healthcare professionals, a nurse working in an ER coming across like a dementia patient and they don't know what to do, they can call the hotline. And someone on the hotline can give them tips to talk them through it. And if it's something that's really serious, we have master level social workers that can handle reporting elder abuse or anything. And we know how to process that. So it's a great first place for people to call. And don't let the 800 number throw you off. Some people think, oh, I'm going to wait forever and hold and people aren't going to be helpful. It's like, those are our rock stars who man that hotline. And so, yeah, they're a good resource for people.
Let's say that again, the 800 number.
800-272-3900.
Okay.
So.
That's
Awesome.
great.
So are we seeing more people with Alzheimer's, or is it decreasing?
That's an interesting question. I'm going to give you, we have some time, I'll give you one more geeky answer. So age is the greatest risk factor, okay? So the older you get, the greater your risk of getting Alzheimer's disease. By the age of 83, 1 in 3 seniors will have some kind of dementia. So that just tells you how it progresses. Because we have the baby boomers retiring, we have more people entering that bracket, which is the reason why we're projecting these big explosive growths in this disease. But we also, there's a recent study that came out, and I just forget the name of it, where they were seeing the actual physical number of people declining. Okay, now that can be a very positive thing. It's like, hey, maybe some of this prevention is working, maybe people are taking their health more seriously. But overall, that's not going to decrease the numbers. So the percentage-wise, the number of people getting it are fewer, but the number of people in the risk category are greater. So you're still having more of this increase in people getting it. Does that make sense?
Yeah.
So maybe fewer numbers percentage-wise, but the number of people in that category and the net mass number of people who are going to get it is increasing. So that's sort of where we're at with that.
Are we making headway as far as getting a cure or at least solutions that help?
Yeah, it's a hard road to hoe. It's been a long time since they've had any kind of significant breakthrough, but there's a lot of really good research happening. And it's one of those things that, you know, we're looking at, okay, there are things happening and we can tell by what's happening that we're going to turn a corner here. That's what we're hopeful for. There's a lot of global cooperation since this is a global epidemic that's brewing. And the Alzheimer's Association, I mean, we're very local. We're very concerned about people face-to-face in our counties and communities, but also it's a global reach. One of the leaders in coordinating and collaborating globally. And so right now there is a global effort to get neuroscientists to collaborate in scanning and mapping the brain. So that's one thing. The Alzheimer's Association directly was very instrumental in getting a tool in the hands of those researchers to make those PET scans and MRIs more effective. So like when you take a dye and you inject a dye in your heart so they can see what's going on in the blockage of your heart, they didn't have anything like that for those beta amyloid protein builds-up in the brain. So you're scanning and trying to guess, what's the size of the brain? Are we having shrinkage? But there was a group of scientists that developed this injectable dye that lit up that protein.
Great.
And so we were very instrumental in helping getting that through all the necessary hoops to get it out there. So that's now out there and getting in the hands of scientists who are doing these scans. So that's going to give us a lot more research. And we're also involved in trying to be a holistic approach. When we find a drug that can help, sure, but then what about prevention? What about health and diet? So there are studies going on, we're in the midst of going on right now, to study that. Do we know, can we say this definitely does help prevent? So we're in the process of learning all those things. So it's good, but it's like, oh man, I wish it could be faster. But, you know, the brain is like the universe, and we've only been to the moon. So we've got a ways to go, but we're making progress.
What kind of fundraisers do you guys have around town?
Okay, so we are mostly funded by individuals and then some grants, very little federal money, which in the state of Illinois right now we're in a good position because and a lot of places that are helping seniors are just struggling. And so thankfully we still made budget this year with the donations that we had come in, and it's because of the amazing people that volunteer for us, and I can never say enough about our volunteers. I mean, I think we have like maybe 70, 80 staff for the state of Illinois, but we have an army of volunteers, and they're amazing. Our biggest fundraiser we do every year is the Walk to End Alzheimer's. The big one here in the area is Peoria. And so that's one where businesses can donate to help be sponsors, and they'll get some marketing exposure. They can get a program co-sponsored that I'll teach, for example. Then we have people that sign up for teams, and they'll just raise funds however they want to or can. And then they just come and we have a ceremony and we walk. So that's a really great fundraiser. It's our biggest fundraiser that we have. But what's also really great about the walk is you really get to see that you're not alone. Caregiving with someone with dementia or Alzheimer's is a very lonely thing. And it's just isolation is a part of the package, because as the person with the dementia, the Alzheimer's, progresses, they get overwhelmed a lot easier about what's going on, and they just want to be alone and withdraw. They want to have that one main caregiver with them all the time, because that's security. So that puts a big burden on the caregiver, and so it's hard for them, and they can feel like I'm alone. But when you come to a walk, you see all these people that have been affected by it. And we have a little ceremony with different colored flowers, little windmill spinner flowers. And you just see the people that are just concerned about the issue. We see people that have lost a loved one to the disease, someone that's currently your caregiver. We have occasionally some people that have dementia and they're walking and they have their own flower. And we just unveiled the white flower. And the white flower is sort of the hope of, the white flower is for the person who survives Alzheimer's disease. So we're looking for that first survivor of the disease. But it's just really moving, a really powerful way to see you're not alone, meet other people that are going through the same thing you're going through. And we hope then that maybe people get involved in a support group, which we also have in the area. And then we also have Longest Day, which is a fun thing. It's sort of a build your own. It's on the summer solstice, the longest day. The idea is do something unique that maybe your loved one who has the disease love to do it all day, and then just raise funds around that. So an all-day bowling tournament, play cards, or whatever. And there's flexibility. You don't have to do it all day. And you can do it on a different day if you want. You don't have to do it on that day. But it's a fun way for people to help raise awareness wherever they're at, raise funds, and do it in a way that honors the person that who has the disease. So
that's awesome.
So if you know somebody that has the disease, say if you're trying to help the person that's helping them out, whether it's a spouse or a sibling or a child, how do we help them?
I think a lot of them, some of the biggest needs they have, a couple things. Just practically, be willing to step out and do something to help them. Mow their lawn, shovel their snow, and just really go to them and say, what do you need? How can I help you? And very likely they may go, oh, I'm fine. It's just, again, that stigma, I don't want to ask people for help, but they really do need help. So I would encourage people to be pleasantly persistent. And if they say no, they're not telling you the truth. I'm sorry. They need help. Yeah. But just pleasantly persistent. What are the little things you can do to help? Get a little education on how to communicate with someone with Alzheimer's, and be willing to sit down and just hang out with their loved one for a little while. If it's with even something like an hour, that caregiver can get away. And don't let them go shopping for groceries. Let them go do something for themselves so they can relax. That can be some of the biggest help.
I just remembered we had a pastor that had Alzheimer's, and he was retiring, and his wife, her problem was she just never felt like she could get away.
Yeah.
And was always, I know that I can be a bit of a pain for my wife, so I'm sure that, there's times she needs to get away. But I think that's sometimes the biggest thing, is just to be able to have your own life a little bit and get away from that situation for a little while, especially if it's stressful or even violent.
And it's 24 hours a day, and it's the person you love, but they're different, and there's behavior and communication challenges, and so it really takes a toll on caregivers. Caregivers who care for someone with dementia, you compare them to other caregivers. Dementia caregivers are 2 times more likely to have emotional problems, financial problems, health problems. It really is a heavy burden for them to carry. So as much as, and people around them can reach out and help, it's just really important.
So what about these counseling, or not counseling, but support groups for them? So when are they, or is it something they have to go attend?
Right.
But maybe that's something you could do, is go be with the person they're taking care of so that they can attend this support
That
group.
would be one of the best things you could do for them, because we have different support groups in the area.
Okay.
Go to the website, call the 800 hotline, and they can give you a current list wherever you're at. And that's just good face-to-face sit down with other caregivers and hear their stories, get ideas from them. It's one of the most powerful things out there. And again, that program is fully run by volunteers. We just have a couple people that help supervise. But
where do they typically take place?
And just varying places in the community, sometimes at a church, a community hall. It's just they're individual programs that are run by the facilitators, just in different locations, different times, different days of the week. So that's one thing. I would also encourage anyone that's just been recently diagnosed, and once they're ready and they would like to be involved in that kind of a support group, we have an early stage support group for anyone in the beginnings of memory loss issues. It's an 8-week program / support group for them and their care partner, the person who will probably be the one to care for them the most. For them to go through together, have a little education, what to expect, and then they go in their own groups. So the people with the disease can talk to other people that are going through this as well. And same for the caregiver. And that's an 8-week program, which is now covered by a grant, so there's no cost for that. There's care navigation, where they can sit down one-on-one with a social worker. We have Olivier in our office. He's amazing. And by appointment only, you fill out the paperwork. That's covered by a grant. It's a little intake paperwork to help us with the grant study. But it's free, an hour and a half, to help them navigate any struggle, any obstacle they're currently facing in caregiving, whatever it is. So that's another really great resource that we want people to know is out there.
We have about 2 minutes left. What's your biggest need?
Wow, biggest need. I just think I want more volunteers. I mean, we want the walk to grow. We want more funds to grow. But I really think if you look at the heart of the volunteerism, we could just use more volunteers. We have the volunteers for the walk. And I'm going to tip my hat. It's a little early, but we're also going to start in the next year or so trying to incorporate more volunteers to help do education in the communities.
Oh, cool.
I can't go into too much detail about that. It's still being worked out. But, I mean, retired social workers, retired teachers, nurses, I mean, those could be some great people that could really contribute in that respect. So we're going to be increasing the way we use volunteers even more than we already do. Because when you're having tripling, the number of people with the disease are going to be triple in the next 35 years, we cannot cover the need with paid staff. We've got to have people step up and help us to get the word out, to help just get people taken care of.
Yeah, and educating is not hard, just got to be passionate. So.
Yep, and if support group facilitators helping with the walk or special events, there's a lot of ways that people can get involved. And then again, on our website, alz.org/Illinois, on the sidebar on the left, go down, you'll see volunteer, and you'll see all the different ways that people can volunteer.
Perfect.
All right, thank you. Daryl Carlson of Alzheimer's Association, Central Illinois chapter. Thank you so much for your time.
Yeah, thank you guys very much.
Thanks for coming back.
Yep, absolutely.
Make sure you like us on Facebook. Share this with everybody, especially if somebody you know that has Alzheimer's or around that area. Make sure you share it. Thank you. Have a good day.
PeoriaLife.com